I feel depressed most of the time. I also suffer from anxiety and panic attacks. Is this normal, or am I suffering from a psychological disorder? Whom should I go to? A counselor, a therapist, or a psychiatrist to solve these problems of psychological disorders? But I don't know the difference between these three professionals. I want to understand the concept of psychological disorders. If you also have these questions in your mind, let's try to understand the concept of psychological disorders in today's video.
My name is Anmol. I'm a mental health practitioner, counselor, psychologist, career coach, life coach, and life skills trainer. I'm here to share my insights and learnings with you to tackle life challenges and attain your highest potential. Let's create balance in your life.
Hi everyone, I hope all of you are doing great. Welcome to my channel Ask Life with Anmol, where we try to create balance in your life and understand some psychological topics. The topic that we have chosen today is of psychological disorders. It is very common nowadays to say that I am feeling depressed, I have anxiety, I have OCD. But do you really understand what a person goes through when they have these psychological disorders? When do we call when someone has a psychological disorders? And how to treat these psychological disorders? And lastly, what are the different types of psychological disorders? All these things we'll try to understand in today's video. So stay till the end. Let's try to understand first what data has to say about psychological disorders. If we talk about global data, about 280 million people worldwide suffer from depression. It is leading cause of disability globally according to WHO. Over 301 million people suffer from anxiety disorders, and 7 lakh people die by suicide every year. This is our global data related to mental health. Now let's talk about India. What India has to say about mental health. 1 in 7 Indians suffer from some of the mental disorders according to ISMR report 2020. The mental health burden has doubled in the past 10 years due to excess stress levels, enhanced social media usage, and other factors. 45.7 million suffer from depressive disorders and 44.9 million suffer from anxiety disorders. Today's youth, specifically 15 to 29, are having high amount of psychological disorders in India. If we talk about recent cases, you might have heard recent cases of suicide of students in the quota because of their pressure of competitive examination. Some of the engineers also are dying. If you talk about the case of Bangalore and other states, many software engineers have taken the case of suicide. And lastly, you also hear suicide cases based upon relationship. If you saw the last suicide case of depression and suicide because the wife was creating dependence and pressure on the husband. That's why he did the suicide. So all these things related to mental health are causing suicide in the Indian population. And the last shocking number is over 80% of Indian population do not get the treatment of mental health disorders. So if you see, these numbers are alarming and it is going to increase in the next couple of years. Depression, anxiety, and psychological disorders are on a high. Relationship issues, career issues are increasing day by day. So what we can do, and let's try to understand what actually is a psychological disorder. Definition of psychological disorder: it is a pattern of thoughts, behaviors, and emotion that significantly impact an individual's daily life, relationships, and overall well-being. So this is a general definition of mental health disorder. So when can we say someone is suffering from a psychological disorders? A disclaimer I have to give you here: only a clinical psychologist or a psychiatrist can tell you what disorder you are suffering from. But as we have got an understanding and qualification of psychology, I am sharing you the general insights, right? But your case might differ. The first thing is that you have persistent or recurring symptoms of a particular disorder. So for example, it is very normal to feel low sometimes. It is very normal to see the sad part in life. It is normal to be negative about life. But if it is recurring, if it is chronic, it is happening again and again for you above the statistical definition of normal. Let's say people are facing 5 times and you are facing 10 times, then we are telling you that it is a psychological disorders. Second is emotional distress. It can be anxiety, it can be sadness or fear. It is again long term. It is not short term. So it can be fear of detachment, fear of failure. If it is hampering your life, you are not able to fulfill other areas of life and responsibilities, then you are suffering from a psychological disorder. Third is disruption in social, occupational and personal life. So you might have seen people who are depressed, they are not able to do their routine responsibilities, they are not able to bath, they are not able to talk to people, they are not able to do their work, right? So your social life is hampered. You are not able to do anything. You're not able to sustain your relationships, you're not able to work on your career and work on yourself. So that is one more condition when someone is suffering from a psychological disorder. Difficulty in coping with daily responsibilities, right? So for example, if you want to pay bills, if you want to do cleaning, if you want to do any of the household activities or your responsibilities, you are not able to do. That is causing you a problem. So that is one more characteristic of a psychological disorder. Now, there are some behaviors a person is showing which are socially not acceptable. For example, someone stops wearing clothes in public, which is socially unacceptable behavior. So that means that person can suffer from psychological disorders. Then there can be subjective discomfort. That means according to me, I am having a discomfort which is very personal to me. For example, I feel sadness whenever I go to a social situation. So that can lead to a disorder called social anxiety, right? So that is very personal to me. So if you are also having a subjective discomfort which other people don't feel, that can also lead you to psychological disorder. And lastly, inability to function normally. You have some maladaptive behaviors, right? A person, for example, is drinking too much. There is a alcohol addiction to you. You are using it as a coping mechanism to solve your stress level. A person who is too indulged in relationship too much, right? So if it is excessive nature in any of the fields, and that is counted as maladaptive behaviors, right? For example, most of the people who are suffering from anxiety, they like to cut their skin, because in anxiety people feel numbness in their skin. So they cut their skin to relieve their anxiety. So that is a maladaptive behavior that people adopt when they are suffering from psychological disorders. So these are some of the characteristics. We will write this down in your, or you can see it on your screen. If you are having any of these, we would highly recommend you to go to a psychologist or a counselor. Now, what are the causes of psychological disorders or mental disorders? Why people suffer mental disorders, right? The first one is a biological reason. So biological factor is your brain wiring, your structure of brain. You had an injury on brain. There are some chemicals called as neurotransmitters in brain. That secretion is low or high. That's why you are having a particular disorder. So it is a biological model, right? That you had some issues with the brain, and that is leading to any kind of psychological disorder. For example, a person who had an accident and had a head injury, some of the part of the brain was damaged. So that's why now they are suffering from a particular disorder, because they were not able to secrete some of the neurotransmitters, right? Second is environmental factors. Now, environmental factors, also known as societal factors, is that in your childhood you were abused, right? There was a stressful life event, you lost someone. It can be related to your relationship also, right? So that leads to a psychological disorder. So a person who is abused mentally and physically during childhood, they might suffer depression, post-traumatic stress disorder, or any other kind of disorders when they grow up. So that is our environmental or social factor. Last is psychological factors. Now, psychological factors are related to our coping mechanisms. So we have developed our brain and psychology in such a way that is maladaptive to us. For example, I convert my aggression into my known ones, right? So if you have not seen our video on defense mechanism, it is how we create defense mechanism, and that can lead to psychological disorders. So we will link the description of that video in the description box. So coming back, psychological factors are when I have created a particular belief in my mind and then I'm continuing it. For example, if I have negative thoughts, right, about anyone, I wash my hands multiple times. So that is OCD. That creates OCD in my mind, right? So this can be related to behavior, learning experiences, or any coping mechanism that I have developed. Now let's try to understand what are the different types of disorders. Now we are coming up with a series of mental disorders or psychological disorders, where we would be discussing about each disorder in detail and giving you different cases. How can you see these traits or symbols of this disorder, right? So this is just the first part of that particular video. So subscribe to our channel if you want to learn about the psychological disorders. So let me tell you in brief what we would be covering. First one is mood disorder, right? That means your mood is high or low. And some of the disorders of this category are depression, bipolar disorder. Second is anxiety disorder. Now there can be anxiety related to general anxiety, social anxiety, and many other types of anxiety. So that we would be learning in anxiety disorders. Then come personality disorders. So that can be related to long-lasting negative behaviors or patterns such as narcissistic personality disorder, borderline personality disorders. So we would be learning about these particular disorders in detail. Next is psychotic disorders. Some of the extreme cases when we have delusion, hallucination, for example, schizophrenia. So all these comes under psychotic disorders. Then we have trauma-related disorders, like I told you before. If you had a trauma, you are a war victim, you had a neglectful abuse in childhood, that is related to PTSD, that is post-traumatic stress disorder. Then comes OCD, obsessive compulsive disorders, right, which are repetitive thoughts and behaviors which cause this particular disorder that we would be discussing. Then comes eating disorders, right? People either overeat or undereat. That is also coming under this particular umbrella of eating disorders. And lastly, we would be discussing about disorders related to children, that is neurodevelopment disorders and like ADHD, autism spectrum disorders. These are the brief categories of disorders, psychological disorders, right? So again, I'm repeating, we are coming up with this series of where we will be explaining each of these disorders in detail. So subscribe to my channel if you want to watch those series of these mental disorders. Now, how do you treat these psychological disorders, and are these treatable or not? So treatment of these disorders are a combination of your medication, psychotherapies, lifestyle changes like meditation, running, walking, and lastly support groups or support channels, right? So a combination of all these things can help you combat these psychological disorders. Now you might have these questions, whom should I go to? There are many professionals in the field. There are counselors, there are coaches, there are psychiatrists, there are therapists. Whom should I go to when I need help with my psychological disorder, right? The first thing that I would like to tell you people that you should go to is a counseling psychologist if you are suffering from a lower level of disorder. For example, there is stress related to career, there is stress related to relationships, then you can refer to a counselor or a counseling psychologist, right? They use talk therapy, right, and some behavioral interventions to help you combat the disorders. You should remember one thing, counseling psychologist or counselor cannot prescribe you medication, right? They only work on the talk therapy model. And lastly, the qualifications that you have to see of these people is masters in psychology or counseling psychology. That's the minimum qualification to become a counseling psychologist in India or abroad. Second is your clinical psychologist. Now, clinical psychologist is for severe mental health disorders like depression, like anxiety, like schizophrenia. All these are high level of disorders. Now, clinical psychologists used therapeutic techniques and other interventions to treat you. Again, they cannot give you medications, right? They only work on these therapeutic techniques. They use CBT, REBT, psychoanalysis. So all these kind of interventions and therapy techniques they use. The educational qualification in India that they have is MPhil in clinical psychologist. You can also see RCI. RCI is the registration number that clinical psychologists get in India. So if you are going to a clinical psychologist, please ask them what is their RCI number, because there is a lot of fraud going on today. So please refer to the RCI number that they are getting. And lastly, you can go to a psychiatrist, right? Psychiatrist helps you with these conditions of depression, schizophrenia and other disorders. And the only difference is psychiatrist can give you medications, right? But they cannot give you therapy, right? They can only suggest you medication which will help you reduce your anxiety, depression or any disorder, right? What degree they have? They have MBBS plus MD in psychiatry. So that is their qualification to treat this particular disorder. If I tell you an ideal case, you have to take, if the disorder is at a higher level, then you have to take a combination of your medicine, that is from a psychiatrist, as well as therapy. And minimum to minimum, that is 6 months to 1 year, a person needs to combat any kind of psychological disorders, right? So these are the 3 people you can go to if you are suffering from any kind of mental disorders, and I told you about their educational qualifications and what they would be treating. I hope you understood about different kinds of disorders, different interventions on how to combat with these disorders, and what are the prerequisites of these psychological disorders. If you want more information, we are coming up with a series of psychological and mental health disorders, where we would be giving you information on what are the causes, what are the symptoms, with some case studies of this disorder. So subscribe the channel if you want to learn about these disorders more. Share this video with your friends and family members to generate awareness about mental health. Like this video and subscribe to my channel, Ask Life with Anmol. Keep growing.